Does having a thyroid nodule mean you have cancer? Hi, I'm Dr. Dhillon. I'm a board-certified head and neck surgeon, and you're watching the FemHealth channel. First, let's talk about how common thyroid nodules are. Thyroid nodules are actually pretty common, and they affect a significant portion of the population. Studies estimate that more than 50% of adults will have a thyroid nodule by the time they reach 60 years old. They are also much more common in women than they are in men. The prevalence of thyroid nodules can be as high as 30% in women, depending on what study you look at. In men, it is around 1 to 2%, so much lower. Now, luckily, the vast majority of thyroid nodules are benign, which means they are not cancerous. According to many studies, 95% or more of thyroid nodules turn out to be benign. This is very reassuring for patients who have a nodule. Now, unfortunately, for some patients, this may not be the case. About 5% of thyroid nodules are estimated to be cancerous. Now, let's discuss factors that may increase the likelihood of a thyroid nodule being cancerous. The first is age. People over 50 with thyroid nodules have a higher risk of cancer. Another one is family history. Having a first-degree relative with thyroid cancer can also raise your risk of having a thyroid nodule that is cancerous. Another risk factor is exposure to ionizing radiation. Radiation from a CT scan or an X-ray does not count as ionizing radiation. Ionizing radiation exposure, especially in childhood, is another big risk factor. Finally, if the doctor sees rapid growth of the nodule, this also increases the likelihood of the nodule being cancerous. So what is the importance of a biopsy in all of this? If you have a thyroid nodule, a fine needle aspiration biopsy, or FNA, is the gold standard for determining if the nodule is cancerous. This is a minimally invasive procedure that can provide a definitive diagnosis, giving you clarity and peace of mind. There is another video on this channel that discusses this procedure in detail. Remember that understanding the likelihood of thyroid nodules being cancerous and knowing the risk factors can help make you an informed patient and make better decisions for your health. I hope you found this helpful. Remember to subscribe below, and I'll see you next time.